And we are live, guys. This is the Men of High Value channel. My name is Joseph Darling. Today I'm doing a special message to the world leaders, the governments all around the world, and the authorities that are leading us in this coronavirus situation. To understand clearly where I'm coming from, I'm just basically a random guy who studies leadership, who has had several businesses, and who desires to share principle-based leadership and basically emergency situations, basically helping the world to see what can be done during this crisis if we think rationally and with leadership and with the right hats on. Okay, so this is not my place, but I'm giving suggestions that can be used by the world leaders everywhere. Now, first of all, let's look at what could have been done in terms of prevention, because an ounce of prevention is worth a pound of cure. And if we knew that already things were happening in Hubei, in China, already in the middle of January, or in the beginning of January, already there were beginning to be whistleblowers saying that this is something that is going to become huge, this is critical, and we need to be able to basically share this information with the world. Already at that time, I'm going to use the example of my, basically my native country, Norway, as an example during this video. But what should have been done is that they should have immediately sent representatives, Norwegian representatives, spies for that matter, to go directly to Hubei, China, and check out the situation, understanding from its source what was going on and not just getting it from the media or from the World Health Organization. Getting on the ground information is absolutely critical, and we didn't hear anything about anyone doing that. Furthermore, once the World Health Organization mentioned on the 30th of January that this was going to be a public health emergency of international concern, once they declared that, it should have been immediately that Norway, again using it as an example, they should have closed the borders that day. And they should have closed it for incoming passengers from outside the country. They could have done this very easily by basically saying at the borders, sending all of their military or whatever they needed to send out to protect the borders, and to tell the airplanes that they were not allowed to land anymore. And if the people were to land, then they would send those planes back to where they came from. A lot of juggling would have needed to happen for this, of course, for this to add up. But that was the day they should have made the changes. This was basically hindsight, right? I wrote this 7th of March on my Facebook profile. So, of course, 2020 hindsight. However, if I was a world leader, that's how I would have been thinking. And I'm not a world leader, so I wasn't really thinking about the processes during the time when this was actually happening. But in hindsight, if they declare public emergency for the whole world of international concern, that's the time to close the borders. And if they sent those representatives to check what was actually going on, then they would have known for sure that, yes, they needed to close the borders. For anyone wanting to come inside the country that were Norwegians or that had been on holiday, whatever, they could come inside the country if they had been in quarantine for 3 weeks, because during that time we already knew that there was approximately 2 or 3 weeks incubation period, just so that we knew for sure that if they came into the country, they were completely clean, everything was perfect. People could travel outside the country, but coming into the country, big no-no. The first case in Norway happened 4 weeks later. 4 weeks. That was the first time anyone was tested positive for the coronavirus or the COVID-19. So that's prevention, okay? We completely missed the boat. And what was interesting is that no country managed to do exactly this, okay? So the next part of prevention would now be the lockdown. There is nothing else that we can do right now except for flattening the curve. However, there needs to be a system whereby we do that so that people don't panic about their jobs and their future, basically, financial outcomes. In order to protect everyone, what needed to be done was to basically put a lockdown, and this was a voluntary lockdown. Now, people are like, no, you have to force people or else they're not going to do it. Well, right now, force never ever works. And it can be proven because if you forced people and citizens for years and years and years with taxes and with all these different things that the government does to basically, with surveillance and everything, if instead they had if they just allow people to do whatever they want, but have basically a clear message of how serious this is and that they need to stay inside if they want to protect themselves and if they want to protect the whole country as a whole, or else it's not going to work. If that was a clear message on the 30th of January, we're going to have a whatever, maybe this happened in the beginning of March, because if there had been a prevention, then there wouldn't have been any cases. But if they did this in the beginning of March, saying we're going to have 2 to 8 weeks of lockdown, but that's it. That's it. If everyone knew that there's a time limit, and after the 8 weeks, everyone can do whatever they want again, we just need time. Because that is what governments have not had, because they responded late, basically all of them. They now have to go in organization crisis mode, where they need to organize themselves. They need to organize the health personnel, they need to organize the equipment and protective gear, and they need to organize the country so that they are ready for exponential growth of COVID-19 cases. This is not what's happening in the world today. What is going on in the world is very, very disheartening and very sad from a government standpoint. What is going on today? In Norway, as an example, what is happening? 250,000 people only in Norway have now been temporarily laid off and are basically asking for welfare money so that they can stay at home because they're not making an income. Okay, so for me, that is crazy. If we're at war with the virus, then why on earth would people go home and relax? All of them. That's crazy to me. And then instead have to focus on giving money to people, to their citizens. They should be solely focused on the one task at hand, which is the lockdown. They should be focused on the one task at hand, which is to protect the lives of their citizens. But instead, they focus on, oh, well, we need to get chopper money for this person and for this person and for that person, crisis packages for basically all the businesses around. No, we're trying to do a 2 to 8 week lockdown. The financials will come up automatically after 8 weeks. We just need to focus for 8 weeks. Give us 8 weeks, and we're going to solve this problem the best we can. And then we'll figure it out, because you only need 8 weeks in order for you to take care of the health personnel. So I'm going to now go deeply into it. Okay, in terms of the economics, just one last note there. With the people, if they know that after 2 months they're going to be able to go to work and make a salary again, they don't need money. And if they do need money, then they need to ask their neighbors or they need to ask someone else. Now, you can come from the standpoint of, well, the government put me in the situation because I've been paying 2/3 of my money to them my entire life. So since they're forcing me to do that, then they have to be the one who take responsibility for me in a crisis. Very bad idea from the government side. Rather, don't charge a lot of taxes from people and allow people to govern their own lives and their own money and their own time. If you allow them to do that, then in crisis situations like this, then they can take care of themselves. In crisis situations like this, they'll be able to have 3 to 6 months of emergency funds in order for them to survive if they're temporarily laid off, or if there's a virus from China coming in to take over the world. Do you understand what I mean? So that's what I'm saying here, is that these people should not be the focus during a lockdown. We should be focusing on preparing the frontliners, which are the health personnel, and treating them absolutely amazing so that they are ready, they're trained in order to combat this problem that would be coming in after those 8 weeks, or maybe earlier, but at least they would have been prepared. So forget the money side, let's get rid of this coronavirus situation. Now, in terms of the coronavirus situation, I have a little bit different type of attitude about it, because I'm saying we all need to infect everyone as soon as possible. Now, this is insane. People are like, why would you want to do that? This would be the worst thing possible. So hear me out. If we manage to immunize 95% of the population, then this COVID-19 is not going to be a problem pretty much ever again. So, because of herd immunity, right, with vaccination. Now, people will say here, well, the vaccination, the experts and the researchers are saying that this is going to take 18 months. That's ludicrous. It's absolutely crazy that it would take 18 months. And that? Well, people say, well, it usually takes 8 to 10 years. Okay, that's even worse. Okay, but 18 months, the reason why, if you look at how they produce the vaccines and what they're saying of the reasoning why it's going to take that long, first of all, the preliminary round is basically coming up with the vaccine. That was basically figuring out the DNA or the, I don't understand all the terms there, but it's basically figuring out what is needed to be in the compound in order for the vaccine to work. Okay, this has already been done. The vaccine is already ready. So what's taking so long? It's the testing of people and, in the first place, animals. That's the process that takes a long time. But then the longest part of all is to get it approved by the governments and then pushed out into the masses. This could be done so quickly, it is absolutely ridiculous. If you think about it, from what I learned, the first phase is to test animals. This could have been thought of and done in January, and it actually was. In February, we already had the compound ready for the vaccine, from what I've understood. News channels. Second, so they could have started testing animals immediately during that time. Phase 2 was to test a little group of people in order to check out the side effects and if it has lethal consequences, or, check out what's going on. This can and should have been done immediately, maybe even before the animals. Why? Because then we can more quickly find out if this is okay for humans. Yeah, but who's going to be tested for that? No one would be willing to. Are you crazy? If we knew that maybe, who knows, 10 million people are going to die from this, or however many more there's going to be laying around on the streets, there's going to be people willing to test this vaccine. But you basically just tell them, whoever gets tested for this vaccine, there might be lethal side effects, there might be completely horrible side effects, but you get $100,000. Okay? And if you die, then at least your family gets it. Do you understand that there would be tons of people willing to volunteer for that? Why didn't they do that? Instead of spending $50 billion. No, wait, hold on. It's $50,000 billion in order to give out crisis packages and chopper money to the people and put all countries that are in on this massively up in debt. That's insane. Like, do you understand what I'm talking about here? Worst case scenario, they released 50,000 plus prisoners in Iran in the end of February, beginning of March. I don't remember when it was. How about we use them for testing? Okay? Like, how about we use rapists, pedophiles, and all those bad guys that are in prison? How about we use all of the worst terrorists in the world? Let's test the COVID-19. Okay, do you understand? All of this could be done in a matter of days, everywhere or wherever they've chosen to do it. Humans are exactly the same everywhere. So the human compound and putting the vaccine together, it would have been simple, easy. And then the approval of the vaccines, literally, once we see that there's no side effects, and there's literally, what, 10,000s of people working on these vaccinations processes, how about we just work and collaborate together in order to get the best vaccine? Now, I understand the competition and stuff, so I'm not going to go into that. But basically, do you understand right now how fast this process could go if there wasn't all these ethical and moral dilemmas. Are you kidding me? There's going to be massive moral dilemmas. Who should live or die at this hospital? I don't know. It's a nurse making a decision. Craziness. Get the vaccine out and running ASAP so that these lockdowns don't have to last forever. Because you know what's worse than the vaccine? The economic crisis that's going to come as a result of this. And countries going into debt and then kicking the can down the line for there to be a huge, massive financial collapse eventually. It has to happen. And because of the pensioners, because of everything that's going on in the economy. So just that was the quick thing about the vaccinations. If it could already be in place in February, May, man, this would not be such a massive, huge issue anymore. So moving on from the vaccination aspect and the 95% of people infected as soon as possible with the vaccine, I'm saying positively infected, okay? Don't get me wrong. I want them positively infected, either with the vaccine that we know works because we've tested it on tens of thousands of prisoners in Iran, or we allow the population to become infected while we massively ask the elder people and those that are in the risk zones to isolate themselves, or we help them to isolate them. We find ways of sending food to them, to send medications to them, to find all of the people who need help and then connect them with people who are willing to help them. Okay, because there's tons of lonely elderly people who have to do everything themselves. In this kind of crisis, this is absolutely ridiculous. They should get our help to do that. If we were prepared, we could have done that. So basically, do you understand where I'm talking about here? Prevention. An ounce of prevention is worth a pound of cure. Moving on from that, what do you do during the lockdown? Because this is what's crucial. This is what's, you get 8 weeks to prepare. And then everything's going to open again. Everyone's going to go and take the bus. Everyone's going to go in the malls. Everyone's going to work at anywhere again, except for everyone who can work at home and all that stuff. But during the lockdown, number one priority, make sure that people are breathing. That's number one. It's a respiratory illness, an infection, and that's why we need to make sure that people are able to breathe. That's number one. There is nothing else. Okay, so what do we need to do in order for people to keep breathing? First thing is all of the companies that we know are going to have a lot less demand because of their factories. People are not buying their products anymore because they're going to be staying at home, preparing, and instead of them producing or basically laying off tens of thousands of workers, we shift the focus to producing equipment, to producing protective gear, to producing masks, to producing ventilators, to produce everything that's necessary for health personnel to remain healthy. If we have too few health personnel, everything is going to go down the drain no matter what. We've got to have strong health personnel who are healthy, who are able, and who basically have the energy to not make mistakes and to be there for as many people who need their help as possible, right? So the production would have to be done there. All the companies that are laying people off, if there's anyone that has any inkling or expertise or that could be trained in operating these machines or to produce more of these machines so that we can send them to other countries that maybe need them in the future, produce it. Make it now. Instead of sending 250,000 people temporarily laid off to be at home isolated, put them to work and put them to work where they should be working to prevent the furtherance of the COVID-19 happening faster than the health personnel are able to contain it. Okay, second of all would be the health personnel recruiting and training. All or half of the doctors should be asked to participate in emergency restitution or emergency room situations, okay? Half of the doctors, and then the rest of the half can take care of all the other people. And then you could beg the people to not go to the doctor if you don't have to, because there's no capacity for doctors at this point in time. Or basically tell all the doctors that their books are full and then direct them towards participating in the ER situation. All medicine doctors, students, all nurse students, all of the people who've been nurses in the past, get them back on track to doing this again. Or ask anyone that has a clean slate from the police to report themselves for duty to help out. Because come on, how hard is it to be guided to do the right things at the hospital if you just got a little bit of training in knowing what to do with each patient in an ER if they have COVID-19 problems, and then paying them well? Okay, not just saying, no, yeah, anyway, if you understood what Norway was doing, it's absolutely crazy what they've done there, because they're not recruiting people, but they should be recruiting people. Not only that, but they should also make sure that if the schools are taken out, which this has actually happened, they put in kindergartens and schools for the health personnel to be able to go to work. So that's something fantastic that Norway has done, so that I'm grateful for. Other than that, what else could be done? Well, we need to make sure that these health personnel are energetic, are fired up, are excited, and are ready for battle, which means instead of them going back and forth to work every single day, basically infecting their cars, infecting their homes and everyone in their homes because they got to go back and forth every day, they could live at a close by place near the hospital. Maybe take the building that's next to the hospital, apartment building, ask all of the tenants there to live in the hotel temporarily, like the Radisson Plaza, for example, because it's fancy and everything's ready for them because there's no one booking there right now. Have all of the employees either live there or create, you know, like the construction sites, they put like barracks or whatever they're called, like small, tiny container buildings right next to construction sites, so that the construction workers can live there on site so that they can work 12-hour days. This should have been the case next to any hospital that are going to receive COVID-19 patients, so that employees can quickly and easily do this the next 2 months. And there could be easy shifts so that everyone has the energy to keep on going. This is war, guys. It's amazing things that can happen from it if the frontline people had the capacity to do it. Just a few more suggestions and I'm going to wrap it up. Transportation, phone lines, okay? In terms of the transportation, create, you know, the vans, create tons of more ambulances because you'll need it. Simply take a van, strap on a hospital bed in there, and then that's an ambulance. You would have that ready for when the COVID-19 thing explodes. And other than that, the phone lines need to be open for anyone that needs information. There should be a channel that's open 24/7 where someone completely repeats again and again and again the situation, what's going on, what people should do, that people can tune into whenever they want to, and then individual help on phone lines where the people on the phone get proper training every single day of what they should be telling people in their individual situation, and especially the 911 number, because that will help people to be directed immediately, because this is a respiratory problem here, to get to the hospital where there are willing and able health personnel to receive them. There's so much more I could share about these about solutions to this, but I'm just saying in general, governments, please think outside the box. And maybe you can learn from this experience of how about the government is not responsible for everyone's life because they charge 2/3 of their money in order for them to become bigger and bigger and bigger and bigger until we only have a government left and no businesses left. Rather, allow people to keep their money through a libertarian system so that people have emergency funds of 3 to 6 months that they're taught and explained to that that's the best thing to do if they're educated, because then they will manage to get through any crisis, including the COVID-19 one of the 2020 year we're living in. This is the Men of High Value channel. Just a quick video that became quite long, but I hope that someone will hear this message. And if it cannot be used for this situation, let us prepare for the next one. Because, hey, we're living in a world that's probably going to get more infectious diseases, unfortunately. But you know what? Every single time our immune systems get better, every single time our bodies improve, we evolve, we become a stronger species, and we're going to get through this together. This is the Men of High Value channel. My name is Joseph Darling. I'll see you in the next video.